Okay, everybody, thank you so much for joining us. I'm sorry we're a few minutes late starting. I appreciate everyone is really busy at the moment, but we really wanted to continue with these webinars to share the Northwest commitment to all of our communities, but in particular to make the most of LGBTQ History Month. I'm really pleased to say that Bill McCarthy, our Regional Director, is going to open the series of webinars for us. So Bill, if I could pass over to you, and then I think there'll be 5 minutes for some questions after your webinar if anybody wanted to flag any, and if people can raise that in the chat, that would be really helpful. Thank you so much. Enjoy.
Thanks, Anthony. And welcome everyone to the first in a month of seminars. Hi everyone, I think I'm on now. I wasn't quite sure, I think we've got a bit of a delay. Hi and welcome to the start of LGBT plus History Month in the Northwest. I think it's going to be a really good month, loads of opportunities, variety of speakers, different webinars, so do make the most of it. We've got 13 webinars across the month, big range of speakers, interviews, opportunity for discussion, and it's all designed to help us to learn from each other and to grow in our understanding of what matters. And what really matters to us hugely in the Northwest is fairness for everyone, equality, diversity, and being a workplace where whoever you are, whatever your background, you will be respected and accepted and will feel really welcomed. So that's what we're about, and that's what this month's about. So I know how incredibly busy everyone is. It's remarkable what you're all doing, what you all achieve all the time. It really is. I can't thank you enough. We've still got COVID rattling along at high levels in our region, coming down, but coming down relatively slowly. I know kind of pressure that puts you under in your work, but also in your home lives. It's not easy for anyone, and I really do appreciate what you're doing, and that's not all we're coping with. Really important we keep that focus on the urgent non-COVID work as well, that we get the vaccines rolled out as swiftly as we can, and that we continue to assure the quality and safety of the services in the Northwest, because that's what matters to everyone. But you'll know that in all of those priorities that we have, a constant thread through them all is our commitment to equality and diversity. It's not and never has been good enough for us to kind of achieve things at the overall level if that's not fairly an opportunity for all the different groups who live and work in our region. And we know through history that different groups have different experiences, tend to be at greater risk of being left out, greater risk of being disadvantaged, and our commitment is to all of those groups. And that's a backdrop for this month, really. We still, to our real sadness and regret, know that LGBT plus colleagues feel less valued and less fairly treated than other colleagues in the NHS, but more generally. We know that they're at greater risk of social isolation and at greater risk of having mental health problems. For example, in the UK as a whole, 1 in 5 LGBT plus people feel discriminated against when they're trying to get a job. can't be right, can it? What, 1 in 5 people worrying just because who they are, will that cause them a problem in getting in getting the employment that they're qualified for and deserve? We know that 1 in 3 people have actually hidden their sexuality when they're at work for fear of being discriminated against. Can you imagine going to work worrying that you have to hide something about yourself because that's going to lead to people either not valuing you or making assumptions about you? That's not how we in the Northwest want to be, and we know that 12% of LGBT plus people wouldn't feel comfortable in reporting bullying, being bullied, because they think that raising those questions would attract an unfair response, not the right supportive response, but perhaps just more of that bullying attitude. So we've got a long way to go. We've got a long way to go to make sure that people of every background, and this month we want to listen to our colleagues from LGBT plus background, so that they feel fully involved, fully accepted, fully respected in our workplace. So many thanks then to our staff network and the other networks in I&E and more broadly in the Northwest, because they've been working on what we can do most productively over this month, and they've come up with a number of themes that then will be appearing in the different webinars over the next 4 weeks. Something about identifying and managing talent, about recruitment and retention. Remember that 1 in 5 stat I've just given you? Really powerfully, I think, learning from lived experience, and it takes quite a lot of courage at times for people to feel comfortable speaking out to our colleagues, and we do have a number of colleagues who've been prepared to put themselves forward over this month. So real gratitude from me to them, because it's always a very powerful experience to hear people's own stories. Something about understanding the COVID impact. It's sometimes it's less visible for different groups, but if you think about what I was saying earlier, that the stats tell us people from LGBT plus background can feel more socially isolated even outside of a time of COVID. You can see that the further risks of isolation that come with the lockdown, that come with the different measures we're having to take through COVID, can just exacerbate that, make it worse. Let's make an effort to understand some of that experience, and also the issues of intersectionality and the impact of that on health and well-being. So a lot of kind of weighty stuff over this month, but I know from colleagues who carry that weight lightly, and it'll be good dialogue, good conversations, good experience, and that's what we should be looking forward to. Plenty of guests. I'm not going to go through them all now. Hopefully everyone's seen the flyers and is taking the opportunity to book into different sessions. But I do just want to highlight our colleagues from Morecambe Bay Trust who are speaking. That they've been that trust has been voted the most inclusive employer in the UK, and that's fabulous. That's that's our institute, our region, and we should be really proud of that, and a great chance to learn from some really good practice. But very important right the way, not just through this month, but very important at all times, that our colleagues feel comfortable about being open, being able to speak up, being welcomed positively to speak up and talk about their experiences. So incredibly important that we, in participating, we're showing interest, but we're being respectful, we're being constructive in our dialogue. Of course, we're going to want to share thoughts, share views, share learning, but all the time, this has to be, needs to be, to support the openness, needs to be in respectful, a respectful dialogue. So let's kick off the month. Let's be really proud of what we're doing. We'll have opportunities throughout the rest of the year to celebrate different groups, different people with different protected characteristics. We've got Disability Awareness Month coming later in the year, but this month is for us to understand more and to celebrate the history of people LGBT plus backgrounds. It's part of our learning, but also it's just part of making the Northwest a great place to work, whoever you are, whatever your background, whatever experience you bring. And if we can do that together, every single one of us will benefit. So thanks very much to Anthony and the team for arranging, organising the month. These things are never easy. They take an awful lot of work, so really do appreciate that. And let's get involved. Let's be interested, and let's have some fun while we're doing it. So back to you, Anthony. More than happy to take any questions or thoughts.
Bill, thank you so much for that and for reiterating your commitment to this. We do have 10 minutes for questions, so if people would like to put them in the chat box, then I can raise them with Bill. If you could do that now, if anybody has any. I notice we've got 66 attendees at the moment, so I'm sure someone's got a question in there.
There'll be lots of opportunities, Anthony. We can always pick them up. There will.
So each one of our webinars will have a Q&A after it. We'll also be sharing a SurveyMonkey link to an evaluation, because we really want to understand what people find most useful about the webinars. And we will be repeating the webinar series across the other protected characteristics as we come to them in the cultural calendar. So if nobody have any questions now, that's perfectly okay. And I'm really happy to move on to Karen. Karen, if you'd like to start off with your presentation, please, through a health and wellbeing lens, that would be really helpful.
Thanks, Anthony. I'll just wait for, perfect. Great timing, Ivo. Thank you very much. And welcome, everybody. My name is Karen Gallagher, and I am the Head of Health and Wellbeing and Experience in the People team in the regional office. And my role is about making sure that the NHS is the best place to work and leading into social care as well for all our colleagues. We know that having a diverse workforce makes for a much greater and better working environment for colleagues, but also for our patients and people who use the NHS. So it's really important to me that we put in place the best experience for all our colleagues, so that we're representative and so that people who come into the NHS to work have a really great experience, and it produces a really great experience for people in their life as well, because we know that we spend a lot of time at work. So in my presentation today, what I intend to do is to cover a couple of things. I'm going to talk to you a little bit about the health and wellbeing offer that's been put in place to support colleagues through this very difficult period. But then I'm also going to talk about what we're hoping to achieve moving forward. And then lastly, what I really want to do is to listen to you, to hear about your experiences as colleagues, but also any views that you have about how we develop our wellbeing offer, how we make sure that wellbeing is embedded across the organisations that we work in. So would you like to put up the first slide, Ivo? That's great, thank you. So the NHS employs 1.3 million colleagues, and how we support your well-being and how we make sure that that we meet everybody's needs is part of the future of the health and wellbeing offer. I'm just checking that people can see that. If you'd like to go to the next slide, please, Ivo. I am on slide 1 still. Ivo. What I'll do, as Ivo puts forward the next slide, which really is about talking a little bit about the presentation itself. So what I would like to say is that the wellbeing offer is not new. Across organisations prior to COVID, we had a health and wellbeing framework which organisations were using to continue to develop a wellbeing offer for all of their colleagues. Thank you. So I'd like to go to the next slide, please. And but what we have in place is a really comprehensive offer for colleagues. So I'm going to provide an overview of that offer, but I also want to provide your feedback and receive your feedback in terms of what we need to do in future. And I think what's really important is, as Bill had said, recognising the intersectionality of colleagues. So I recognise that some people will be able to access some offers, but some people won't. And it's really important that we have a range of offers that meets that whole need of the individual. If you'd like to go to the next slide, please, Ivo. I think there's a bit of a delay. Okay, thank you. So the reason why I've put up this particular slide is that I wanted to demonstrate the way our workforce looks and how we capture data and the importance of data. And I actually recognise that for some, being part of a data set sits quite uncomfortably, and people don't always want to share personal information about themselves. However, what I would say is, when we have data, it does allow us to really think about whether we are meeting the needs of our colleagues. And what you will see on this slide that you can see at the moment is we capture data through something called a pulse survey, which organisations complete. We also can review information from the staff survey, and then we also have information from ESR as a data set. But when I look at that data, there's an inconsistent message, and there is a lack of clear information about what that data is telling us. And one of the things I would really strive to do with organisations is to build confidence across colleagues and with colleagues to make sure that their data is accurate. It is the slide before there, Ivo, that their data is accurate. So as an example, in the staff survey, we know that 1,000 gay men responded, 800 lesbian women responded, and 800 people who identified as bisexual, with 7,400 heterosexual. But there were 35,000 people who didn't respond in terms of their sexuality. And like I say, I understand why people may not want to share that. It seems a very personal and private set of information. But when we know about what our workforce looks like, we can start to say, well, actually, is the offer right? Are we connecting in with our colleagues in the right way? And certainly in my previous role, we worked in the North with colleagues to gain their trust to complete ESR personal data. And then we could use that data to connect with people and say, right, okay, you have told us that there are high levels of bullying and harassment. So you'll see on this bottom right hand side, the table there from the staff survey, it picks up the key themes, and you'll see the longer orange row there. That's the heterosexual, and you'll see the outline of other colleagues and their sexuality. But what it doesn't really give us, if it's not accurate, the levels of bullying and harassment, the levels of well-being offer, how people feel treated in the organisations, and we use that information over and over again to work with organisations to improve their offer, to make it a more responsible offer to what our colleagues need. Could you go to the next slide, please? So I've included this because this is about the people plan. It's about our commitment moving forward. So Bill had really rightly highlighted some of the specific needs that colleagues from an LGBTQ community may experience. So the challenges in terms of recruitment, the 12% who wouldn't report bullying and harassment. That is a dreadful statistic for us as colleagues to think that our colleagues experience that. We know that loneliness is a factor for colleagues who identify as LGBTQ. But not only that, during this period, people who are already isolated from their family that loneliness will be intensified because they don't know what's happening with family around COVID, how their well-being is. And so that increases stress and anxiety at the moment. When we move, and as we move forward, there is a key part of the people plan that is focused around well-being and what well-being looks like in the future. And we're really keen that we change mindset and culture so that leaders, managers, colleagues, everybody is focused towards making the NHS a great place to work. And that needs to be from a physical perspective, from a psychological perspective, so that everybody who has those moments in their life where they are struggling has somewhere where they can go to, whether that is a line manager who is supportive or it is a external service where they can speak to get confidential support. And we want to make sure that the psychological contract is strengthened, because if it's not, people don't want to be part of that organisation. And as I said at the beginning, having a diverse workforce is really important to us. So one of the things we're currently doing, on the bottom left-hand side of that slide, you will see the development of what we're doing is a health and wellbeing framework, and we're working nationally to say what would that framework look like, and that will be what organisations use to review what their wellbeing offer. And critical for me is making sure that that respects and reflects our diverse workforce and gets organisations to really look through that lens. And so, and what we know by doing that is some of the really great practice that we can build on and also share throughout the Northwest. So Bill already mentioned Morecambe Bay, but also the Cheshire and Merseyside organisations that have been working with the Navajo Charter Mark, which really is about making sure that all the training is in place, their recruitment practices are best practice. And so actually looking at how we make sure that that is shared across the Northwest. I'm going to ask you to go to the next slide, please, Ivo. Thank you. So what does our national people offer look like? Hopefully you will have all been on the National People website and you will be able to see a whole range of interventions to support during this time. They might be, for example, through a pause space. They might be through Sleepio, which is an app that you can download on your phone. And on the right hand side there is a list of apps. Now, me personally, as we've been through COVID, I have accessed a couple of those. I've accessed Headspace and I've accessed Sleepio. And basically, if I talk about Sleepio as an example, you download it on your personal phone, you keep a diary of what your sleep pattern looks like, and then you get some guidance about how you can improve your sleeping. So for me, the biggest thing that's happened that's really helped me is just a simple statement, is that when my mind is running away over and over again, it's just saying I am. And that's all it does. I say I am, and it helps me to sleep. And having gone through a pattern of waking up at 2 and not going back to sleep, I now actually just trip back into my sleeping pattern. So I would ask you to look at those apps. They're confidential. You will find a range. So Bright Sky is free to download. It provides support and information who may be in an abusive relationship or concerned about somebody else they know about. The app Daylight is a smartphone based app that provides people who are worried or have anxiety, and it provides evidence-based cognitive behavioural techniques, voice and animation to support you overcome some of that anxiety. We talked about the psychological and the physical. One of the other apps I've used is the Movement for Modern Life, and it's a British online yoga platform that brings together some world-class yoga teachers, and it just gives you an opportunity at any time in your diary to do some exercise, to do that positive physical thing that will help you possibly sleep or just get some respite from stress or anxiety that you may be feeling. Could I go to the next slide, please? So this also provides an overview of some of the other national offers and guidance. So what I particularly wanted to draw attention to is the Looking After You 2 coaching programme, and there is Looking After You team working programme, and that's for our colleagues in primary care, and that particular offer is available for anybody working in primary care, and the information is available on the People website, and you can access a couple of coaching sessions free of charge to support you with a challenge that you may be facing. You don't have to. Your coaching session and the content of it will not be shared. So it's an opportunity for you to have that private space. That has been so successful that the national team have commissioned a Looking After You 2 coaching programme for our BAME colleagues. Now, I know that won't be available for everybody, but it will be helpful for some parts of our community. And that, again, is receiving really strong feedback. We've offered some React mental health trainer programmes. So we know that organisations, we've got 11 organisations in the Northwest who are starting to become trainers so they can then embed that programme within their organisation. Across each organisation, we have a health and wellbeing lead, and I work with the health and wellbeing lead through networks, and they identify some of the really great practice that they're doing. They share best practice. So, for example, for those shielding, one organisation has got like little postcards, and they're connecting in with their colleagues through those postcards rather than everything being on Teams. And we're interested, we act as the conduit to feedback nationally some of the needs that health and wellbeing colleagues identify within their organisation. We've recently done a stock take that looked at what the physical provision was within organisation, what the psychological provision was, and whether that was meeting colleagues' needs, and what else needed to be commissioned. And then just recently, one of the offers that has been made available is the sustainability assessment through the middle bottom programme, and that is for colleagues who are 8D and above, but also by going through the resilience hubs, and each system has one. anybody can access professional help through that body. So we have a resilience hub in each of the systems, and the resilience hubs have been designed to support you with your mental health. If you are struggling, if you have got anxiety or worrying that is impacting on your mental health, you can go into each of those resilience hubs in your system area and do an online assessment, and they will get you the help that you need. So that is a really brilliant offer, and we're also doing something through the resilience hubs to connect with those colleagues working in intensive care, and there's a bespoke programme to support you. Could you go to the next slide, please? But there are lots of other offers as well. So Public Health England, there's lots of information about mental health support at the moment. We know that people are really struggling, and so wave one, people thought this is just going to be it, wave one, and we'll be back to where we were. And then wave two came, and people are a bit like, well, yeah, we'll get through this. But actually what I'm picking up from colleagues at the moment is, as after Christmas, people have really started to struggle. And so you'll see there, they've done a questionnaire that identified that 54% of colleagues were missing family and friends. 33% will only. Now, this is from the general population. That is going to be higher, I think, in our LGBTQ plus community. They've identified that uncertainty about the future and the financial and employment worries is affecting 27% of the population, and so there is financial support available on the People website. And whilst this is a generic offer, this isn't through the NHS EI People site. I actually still thought the offer here was really good, and so I wanted to include it in today's presentation. Could you go to the next slide, please, Ivo? And then lastly, there are some, this isn't extensive, but these are some of the offers that specific organisations are putting in place to celebrate LGBTQ plus History Month. So I would expect, if you go into your own organisation, if you connect with your health and wellbeing lead, there will be things being organised. Connect with your LGBTQ plus network lead, and if there isn't a lead, then speak to Anthony, and Anthony will work with that organisation to make sure that we support them to get a network in place. And I know there's a lot of work going on there at the moment. So Anthony, that's all I'm going to say, slightly longer than I anticipated. So if there's any questions or comments, I said at the beginning, I was really interested to hear your feedback, and so that's what I'd like to use the rest of the session for.
Thanks, Karen. That's really good. We've had a couple of questions about sharing this, sharing the slides. Is that something that we can do? I know we record the session, but can we share the slides?
Absolutely. Yeah, that would be great if you'd share the slides.
Okay, I'm just looking at the questions, a fair amount of questions. I think most of them are people are thanking you for your slides around the sleep support. They're asking for sharing of the slides. There's some EDI questions which I've been busy answering. Any questions specifically for Karen? If anybody could post them in the chat, please, that would be really good, and I will do my best to keep on top of them.
Yeah, so for me, the question I had as I've been thinking about this is, what does a great wellbeing offer look like for those on the call? It would be really good to hear your views so that we can make sure it's reflected back in what we develop.
I think that's a really good question, Karen. It's all about lived experience, isn't it? How we shape things and design things need to be through the eyes of people in particular groups as well as ourselves, and that's a really good question. So if anybody has any comments, either online or offline, about what good looks like for them, perhaps you could let Karen or myself know, or share them in the chat box if you're happy to do so. just picking up on a couple of other questions, if people haven't had a chance to look in the chat, people are asking, for example, about how we can make our LGBTQ colleagues feel more comfortable about being open without being discriminated against. Working at home puts barriers in our work and often leads to our home lives and our work lives blurring. I think that's absolutely real and true, and I think we're all experiencing that in different ways. I think being open and transparent and asking respectful questions and showing a willingness to learn and reaching out to people are all really important. I think we also mustn't forget that people come from a history of not always being able to be honest or open about their sexual orientation. There's some questions in the chat around HIV and AIDS and how there have been pandemics before the one we're in now, and we need to reference that in the language that we use. So I think there are all sorts of considerations, but I think that if people reach out respectfully and ask respectful questions and genuinely want to learn about what it feels like to be LGBTQ working in the Northwest and more generally, then people will be up and open to sharing that conversation. I do think there's a bit about us to do more around role modelling and coaching and supporting, but I think also people need to reach out respectfully and find out more.
I'm not sure if people can hear me, Ivo. Can you hear me, Anthony?
I can hear you, Karen.
Ah, lovely. So one of the things I wanted to say is it's about psychological safety. So if you as a team create psychological safety, people will feel more genuinely able to share maybe. But if you are a judgmental team, if your humour within that team is criticism, it's against difference, then why would people feel safe to share something personal like that? So I think having come from and done a lot of training around team development in my past, I think creating a really respectful environment, creating a psychologically safe environment, accepting difference within that team will create a better environment for people to share their sexuality. But it can be as simple as ridiculing somebody for the way they dress, for the way they talk, for the way they walk. At a most basic level, if that is your team, people are not going to feel psychologically safe to share something so personal about their sexuality. So I just wanted to add that in, Anthony.
That's really helpful, Karen. We've also got a question in the chat about whether line manager sensitivity training would be helpful and beneficial. The questioner is saying they think that some line managers are fearful of discussing certain topics, and this in particular by the sound of it. Do you have any thoughts about that, Karen?
So for me, I think it is about that psychological safety. We know that we were doing some training previously in the North around unconscious bias, and that has been identified as maybe not as helpful as it could be and can entrench some views. I think for me, when I came from an unconscious bias, knowing yourself, what is your personal bias as a coach, knowing yourself, knowing what your own triggers are, and then challenging yourself is really important. So my background, I'm Irish, I'm Catholic. That is the community that I really identify. Now, because of that, that creates a natural unconscious bias in my own head. I connect to Irish names. It's a community that I was really strongly identify with. But how does that impact on me? And then when I think about other communities, about other religions, and I am absolutely consciously aware of that, especially when I'm going through a recruitment process, that I don't allow that judgment in. And I think in terms of line managers, if a line manager is respectful, if a line manager holds that team and creates a psychologically safe team, then I think you're going to get a more safe and psychologically safe conversation happening with members on a one-to-one basis. What I hear and have heard throughout my career is people saying, I disclosed something to a line manager and I know they told somebody. You only ever have to do that once and you will never be trusted again. So it's just some of it's just the basics really about what you would want in terms of confidentiality, being psychologically safe. But actually there's almost no room for ignorance as well. Look online. Do your research, attend WebExes like this, so you have a broader understanding of colleagues that you work with.
Thanks, Karen. Well, another question in the chat box. So the question says, consideration around recovery. Everybody's working 100 miles an hour. Staff will need time to heal and recuperate. What is there specific support for LGBTQ in relation to this?
So I think the offer that is there is a general offer, if I'm honest. I would be really interested to hear your views about what recovery, good recovery would look like for you. I think what we're trying to do is look at things like annual leave. Now, I know people say, don't make me take my annual leave because I'm so busy. But I've also heard people say, I didn't know how exhausted I was until I took my annual leave, and I'm so glad I did because I feel refreshed. And so one of the things we're doing is putting guidance out there. We're talking to organisations about the hours that people are working. I know that HRDs are starting to say, actually, we'll have to have a managed programme of how we work into recovery. We can't continue to keep asking colleagues to work in the way that they are working. What does that mean then in terms of waiting lists? We've got a retention programme. We're looking at the people promise to say, if we address sickness, if we attend retention, then we have more people at work doing the do, so that there is an opportunity for people not to be working really excessive hours and for people to feel more relaxed about taking annual leave. But really interested to hear your views as well.
So Karen, if people have got views about what good looks like in that context and what people might want the specific offer to look like, are they okay to message you direct? And if that's the case, could you put your email address in the chat?
Yeah, and more than okay, I would proactively welcome that. I would love to hear from you. So yes, please. I'll just make sure I've typed it right. Okay, there's my email address.
Thanks, Karen. Any more questions for Karen? I'm sorry, I'm busy.
Okay, I can't hear you now, Anthony.
Can you unmute your
There we go. No.
Anthony, you have muted your microphone.
So I have. Ivo, would you mind putting the SurveyMonkey evaluation form into the chat, please, as well?
Yes, just
thank you. That's brilliant. Please take a few minutes to evaluate the session. There are plenty more sessions to come, but we are really interested to hear what you tell us so that we can shape, refine, review what's to come through February. I wish you all a really happy LGBTQ History Month, and I really hope you can join us for our webinars that are coming. Take care, stay safe, and we'll hopefully engage with you in the next couple of weeks.
Thanks everybody.
Karen, I haven't seen your email pop up. Would you mind reposting?
Karen, just unmute your microphone.
Sorry. So I can see meeting chat, but there is no questions on there, so I don't know what I'm looking at.
So you need to go to Q&A, which is at the top.
Would you like me to post your email if it's easier for you?
Make an announcement. Lovely.
Yeah, that's it, in there.
_Gallagher. There we go. That's absolutely fair enough, isn't it?
Okay. Does anybody else have any more? Oh, there's another new question there.
Karen, your microphone is muted.
That's fine. I wasn't going to say anything.
Okay, Karen, we don't have any more message. We don't have any more chat. We don't have any more questions. So if we are done, then that's end there. I have signposted people back to the schedule of webinars, which is further up in the chat. So our next one is Wednesday, followed by another one on Friday, and so on and so forth, predominantly Mondays, Wednesdays and Fridays. If anybody has any issue with the schedule or with the chat and needs more information, please drop me an email. My email is in the chat and I can share more information.
Anthony, are you available for a quick conversation, please?
Yes, absolutely.
Okay, I'll give you a call.
Okay, great. Thank you all very much, everyone, for joining us, and we'll talk to you again on Wednesday. Thank you.
Thank you.
Bye.